An example of the way we have supported innovation by the South London and Maudsley NHS Trust was the major investment we made to enable the trust to shift treatment from hospitals to the community. And we were able to fund the creation of home treatment teams around 12 years ago. These have now become a day-to-day part of how we provide services. But without the charity funding it, the Foundation Trust or the NHS Trust then would not have been able to create any of these services. We have funded large and small research. We funded, for example, a research by one of the consultants and senior lecturers within South London Maudsley on why it is difficult to reach particularly young black men, because they do not come to our services. So the research was based on what are the avenues through which we can reach these sort of hard-to-reach groups within our community. And we also funded the evaluation so that the research can be translated to practice very fast. And a smaller piece of research, which was not by a SLAM researcher, was around suicide after a bout of tinnitus. So wanted to understand as to when after tinnitus patients could end up committing suicide. That research is currently ongoing. We have provided a large £2 million grant to the emerging Wall Centre for Neuroimaging, which is being built in the King's College Hospital campus. This will bring together the research into neuroimaging, not only from a physical point of view, but also from mental health point of view. And we are really pleased to be able to support this initiative. The charity decided to use some of its capital funds to build a new learning centre in the spot where the old Southwark Training Centre was on Grove Lane. The variety of projects that the charity funds ranges from authors who need a book published. Recently, we are funding a book around eating disorders. We have funded a handful of films, both by filmmakers and by patients who do it as part of their therapeutic journey. We have funded the Sydenham Gardens and also cafes and other services provided by service user groups.